All right, so I'm here with Dr. Buzz today, and I'm super excited to learn about this product that we have, right?
Yeah.
Called A2M.
Yep. A2M
What
or
is
alpha.
A2M?
A2M stands for alpha 2 macroglobulin, and it's a broad-based protease inhibitor. Those are all big words, but I'm going to try to break it down and make it really simple.
Hmm.
A2M is a treatment, or alpha 2 macroglobulin is a treatment for arthritis. And I think if you want to understand how A2M works, you need to understand how arthritis works first. So, whatever type of arthritis you have, whether it's degenerative joint disease, osteoarthritis, even rheumatoid arthritis, is always caused by the same thing, and that's due to proteases.
Hmm.
So, what are proteases? So, proteases are proteins your body release, and at the time they're released is for good cause. Proteases are like little termites or little cleanup things. So, what happens in people that have arthritis, of degenerative type nature, is it's typically there's some type of injury or surgery before it. So, basically, what happens is we'll say you hurt your knee because knee is a very common area where people develop arthritis. So you injure your knee in sports, you have a meniscal surgery or ACL surgery at some time earlier in your life. And when that happens, your body releases these proteases or proteins into the area to help clean up the damage after the surgery or after the trauma. So at the time, those proteases serve a very good purpose because the body's always perfect. But where it becomes problematic is as we become older. When I say older, we'll say between 30 and 35 years of age, all of our joints become very avascular. They don't have good circulation. So when the body releases the proteases into the joint, but then they can't get out of the joint, they're like termites stuck in the joint. They start to eat away at the joint over time. So that's why you don't get arthritis right after you have the injury. It's over time. And the other thing that can cause this is people that have chronic pain. So if you think about it, anytime you have pain in an area, we'll say you have knee pain, we'll keep it simple, you have knee pain. Your body, the reason you have pain is your body releases another protein called cytokines, which once again, everything's for a reason. The cytokines that cause pain are good because they tell you, hey, don't use the knee. Don't go running today. Your knee has an injury of some type, let it heal. But what they become problematic is when you release cytokines for a long period of time, then the body's like, well, there must be a problem there. We got to release proteases to help heal the injury to clean up the damage. So if you have chronic pain, your body's always releasing more and more proteases into the area.
Hmm.
So, and if you think what people typically do if they have, like, say, knee pain, because you have knee pain, it's there for a few months. So then they typically would take an NSAID of some type. An NSAID would be, Advil, ibuprofen. But the problem with NSAIDs is they help to modulate or decrease the cytokines. It's like kind of like putting duct tape over the check engine light, but your body's still releasing the proteases into there. And
Hmm.
remember, those proteases, more proteases mean more damage over time. And because our joints become avascular as we get older, they can't get out of the joint. Now, if a young person has pain, those proteases can get out of the joint.
Right.
But once you get past 30, 35 years of age, they're trapped in the joint and they're just eating away at the joint. And that's the cause of arthritis.
Hmm.
And NSAIDs won't get rid of it. What would be worse is you take the NSAIDs for a while and that doesn't get better. So then you go to your doctor and you get a steroid or cortisone injection, which is even worse because, once again, that does nothing for the proteases. It simply helps get rid of the cytokines or down regulate the cytokines, but the cortisone shot itself causes tons of damage. That's why they say with each cortisone or steroid injection, you lose up to 7% bone loss, mineral loss. That's why if you think you're only allowed to get 3 shots per year of those, because if you have four, it'd be medical malpractice because of the amount of damage it does. And it still doesn't address the root cause,
Right.
right? Another treatment people do is hyaluronic acid. And hyaluronic acid, although not damaging like the NSAIDs and the steroids are, it never works long term. It's just putting a cushion in there that doesn't last.
Hmm.
So at the end of the day, if you have arthritis, the only way to fix it, other than cutting the joint out and replacing it with a plastic one or titanium, whatever they're using, is to get rid of the proteases. And the only way you can do that is with A2M. So what is A2M or alpha 2 macroglobulin? Well, A2M or alpha 2 macroglobulin is just another protein. It's in your blood. It's actually produced by your liver, and it's the largest circulating protein in your bloodstream. It's in your venous system. But it's so large, it can't get into the joints.
Hmm.
But what we can do is we take a person's blood and we have, a lab in the office and we're able to take your blood, get that A2M protein out of your blood, filter it down, spin it, and then we can concentrate it and then use a needle to put it into the joint, a small gauge needle like a acupuncture needle. But when you put A2M into a joint with proteases, it's a broad-based protease inhibitor. So it literally breaks down the proteases that are the cause of the arthritis.
Hmm.
And nothing else does that. Steroid injections don't do it. PRP doesn't do it. Allografts don't do that. A2M is the only way you can stop arthritis at the molecular level. So, very simple. If you have any type of arthritis anywhere, the only permanent way to stop the arthritic process is to use A2M. By capturing it out of the blood, putting it into the joint, and it inhibits that. And the other cool thing about A2M is it also, when it's breaking down the proteases, it also binds with cytokines, which are causing the pain.
Mhm.
So most people that get A2M procedures notice significant pain release. I've had people come into the office in severe pain and walk out with no pain. But usually within that first week, not every person, but usually that first week, at least a 50% reduction in pain. But the main thing you're doing is getting rid of those proteases. Because if you don't get rid of those, even if you do PRP, stem cell injections, all these other treatments, they're not, those aren't bad, but they don't get rid of the proteases.
Right.
So, the way we do it at Buckeye and the way I would recommend is you kind of think it's kind of like a garden analogy. So if you have flowers in your garden and all of a sudden you have a bunch of beetles in the flowers, you have to make a choice. You could choose to add a bunch of fertilizer to get the flowers to outgrow the beetles, and that's what using a double spin PRP would be, an umbilical cord extract would be, and that's not a bad choice because you might be able to get the fertilizer to outgrow the beetles for a while. But if you don't get rid of the beetles, what's going to happen long term?
Right.
The arthritis always comes back,
Yeah.
and it might buy you a month, it might buy a year, it could buy you up to 3 years. But if you don't get rid of the proteases, it will always come back.
Mhm.
A2M gives us a tool to literally break down and get rid of the proteases in the joint. And then once we get rid of those, then you add fertilizer. You kill the beetles in the garden. Let's add fertilizer, get the flowers to go back. That's where a double spin PRP or an umbilical extract or even exosomes is a benefit to help the tissue grow back. And tissue does grow back. The cartilage you have in your, even if you're 80 years old, the cartilage you have when you're 80 wasn't the cartilage you had in your knee when you were 78.
Mhm.
It's always regenerating. So you just give your body the tools to heal itself because we all have to remember, the body is self healing. You just have to give it the right tools to do so. And the other thing I hear quite often, my doctor told me I have to have a knee replacement, shoulder replacement. The majority of the time that's not the case. Get rid of the cause of the arthritis, add the fertilizer, and let the body heal itself.
I love it. That's cool. That's really cool. And I love A2M. It's like my favorite thing because I really believe in it and I've seen it work on people.
Yeah.
So that's very cool. All right.
Lots of people that were told that they had to have a joint replacement. Now, not everyone qualifies. But the other thing I always tell people is if you went to you wouldn't ask me if you need a root canal because I don't know enough about teeth
Right.
because I don't do root canal procedures. So if you go to your general practitioner or an orthopedic surgeon and you ask them about A2M and they say, well, you're not a good candidate. I don't think it's going to work. They don't mean bad, but if they don't do the procedure, they're not going to know. Just like,
Mhm.
I wouldn't know if you needed a root canal. So I'd strongly recommend anyone that has arthritis and been told they're bone on bone, they have to have a joint replacement surgery, see a regenerative medicine provider that uses A2M, ask them. Not everyone qualifies, but a lot of people do. And, obviously saving your knee or your shoulder or even back surgery is much better than the alternative of replacing it
Yeah.
if you can.
And I know a common question is, are some people ask, does insurance pay for this?
Yeah. I always tell people all insurance works the same way. If you have car insurance and your tires are bald, would you call your car insurance company, Allstate, whoever it is, and ask them to buy you new tires?
No.
Yeah, because insurance only covers catastrophic events.
Right.
So, because A2M is regenerative in nature, just like other regenerative things, it's considered maintenance. So that's not covered. But if
Hmm.
you have to replace the knee, which is catastrophic, that's a major surgery, then that would be covered.
Yeah.
But it doesn't mean it's the right choice.
Right.
And the good news is A2M, umbilical allografts, double spin PRP, these regenerative procedures are very inexpensive and everyone can afford them compared to surgery.
Yeah. And one more question. Are these things FDA approved?
Well, the Food and Drug Administration, these are not drugs, so they're not FDA approved because they're not drugs.
Okay. So they're not FDA approved. And
And they never will be because they're not drugs. The only thing the FDA approves is drugs, which these are not. A2M is naturally occurring. It's a protein that's in your bloodstream, but it just can't get to the joint. So what we're doing is we're taking it from your venous system, concentrating it and putting it back into your body so it can actually get rid of the proteases and break down arthritis at the molecular level.
okay, got it. A lot of people always ask that question.
Yep.
So, all right. Is there anything else you'd like to share?
Yeah, I mean, if you've been told if you have chronic pain somewhere, realize if you have pain all the time in an area. Now, I'm not talking if you stub your toe, but if you have pain for more than a month in an area, most likely it's not going to go away on its own. And remember, if you have pain, your body is releasing proteases into the area to help heal whatever is causing the pain.
Hmm.
So anybody with chronic pain, if you don't treat it, will always end up with arthritis. And if you're taking NSAIDs for the pain, you're speeding that process up because NSAIDs work on the COX-2 pathway, which is the pathway where you build cartilage. So if you're taking NSAIDs on a daily basis or multiple times a week, just realize you're speeding up arthritis throughout your body because you're slowing down the cartilage growth process throughout your body. So that's not a good alternative.
Yeah, I agree. Wow. Awesome. Well, thank you for sharing
Yeah.
about A2M today. I love it. I think it's awesome. So, if you're listening and you're a doctor or provider or nurse practitioner and you're doing procedures in your clinic, and or if you're just somebody listening to this podcast, we're talking about A2M, we're talking about arthritis. A lot of people have arthritis. So,
Unfortunately, but most of those people had pain there prior.
right.
And remember, the cytokines which cause your pain lead the body to release the proteases. And as the proteases build up, at some point, the catabolic effect of those proteases overtake the anabolic ability of your body to replace the cartilage they're eating. That's how you end up with degenerative joint disease, which
Wow.
is 100% reversible if caught in time.
All right. That's awesome. Thank you so much, Dr. Buzz.
Thank you.
Thank you.